Hello everyone and welcome. Today, we're diving into a rare and complex congenital anomaly, urethral duplication. This condition, where an individual is born with more than one urethra, can present with a variety of symptoms and requires careful diagnosis and management. Let's explore this fascinating topic. The exact causes of urethral duplication remain largely unknown, but it's believed to arise from errors during embryonic development. Specifically, disruptions in the process of urethral formation, which normally occurs between the 4th and 12th weeks of gestation, are thought to be responsible. Genetic factors may also play a role, although specific genes haven't been definitively identified. Further research is needed to fully understand the complex interplay of factors contributing to this condition. The pathophysiology of urethral duplication depends greatly on the type and location of the extra urethra. In some cases, one urethra may be completely non-functional, acting as a blind ending tube. In others, both urethras may be functional, leading to issues such as double urine streams or dribbling after urination. The location of the duplicated urethra can also affect its function. For instance, if one urethra opens into the rectum or perineum, it can lead to infections and other complications. The abnormal flow of urine can also impact bladder function and potentially lead to kidney problems if left unaddressed. Urethral duplication is considered a rare anomaly, with an estimated incidence of less than 1 in 100,000 live births. Due to its rarity, precise epidemiological data is limited. However, it appears to affect males predominantly, although cases have been reported in females as well. Some studies suggest a possible association with other congenital anomalies, particularly those involving the genitourinary system. Further research is needed to better understand the true prevalence and distribution of this condition. The signs and symptoms of urethral duplication can vary considerably depending on the specific type and extent of the duplication. Some individuals may be completely asymptomatic, while others experience a range of symptoms. Common signs include the presence of two distinct urethral openings, double or bifid urinary stream, dribbling of urine after voiding, recurrent urinary tract infections, and perineal leakage. In more severe cases, there may be associated complications such as incontinence, bladder dysfunction, and even kidney damage. It's important to note that these symptoms can also be indicative of other conditions, so a thorough evaluation is essential for accurate diagnosis. Diagnosis of urethral duplication typically involves a combination of physical examination, imaging studies, and endoscopic evaluation. A careful physical exam can often reveal the presence of two urethral openings. Imaging techniques like voiding cystoscopy VXUGs, which involves taking X-rays while the bladder is being emptied, can help visualize the anatomy of the urethra and identify any duplicated segments. Ultrasound and MRI can also be useful in assessing the overall structure of the urinary tract. Urethroscopy, a procedure where a small camera is inserted into the urethra, allows for direct visualization of the urethral lining and can aid in identifying subtle duplications or other abnormalities. Urethral duplication can be classified based on various factors, including the location and extent of the duplication, the presence or absence of a functional urethra, and the relationship of the duplicated urethra to the normal urethra. One common classification system divides duplications into three main types: Type I, where the duplicated urethra is a blind ending tube; Type I, where the duplicated urethra originates from the normal urethra; and Type E, where the duplicated urethra has its own separate opening to the bladder. Within each type, there are further subdivisions based on the specific anatomical features. Understanding the classification of the duplication is crucial for determining the appropriate treatment strategy. Treatment for urethral duplication depends largely on the severity of the symptoms and the type of duplication. In asymptomatic cases, no treatment may be necessary, but regular monitoring is recommended. Symptomatic cases often require surgical intervention. Surgical options include excision of the duplicated urethra, reconstruction of the urethra, or, in some cases, creation of a single functional urethra. The specific surgical approach will depend on the individual's anatomy and the surgeon's experience. Post-operative care is essential to ensure proper healing and prevent complications such as strictures or fistulas. Currently, there is no known way to prevent urethral duplication, as it is a congenital anomaly arising from errors during embryonic development. Prenatal care, including avoiding known teratogens, may help minimize the risk of birth defects in general, but there are no specific preventative measures for urethral duplication. The prognosis for individuals with urethral duplication varies depending on the type and severity of the duplication, as well as the success of any surgical interventions. In many cases, surgery can effectively correct the anomaly and alleviate symptoms, leading to a good long-term outcome. However, Some individuals may experience complications such as urethral strictures, fistulas, or recurrent infections, requiring further treatment. Recent research has focused on refining surgical techniques and developing less invasive approaches to manage urethral duplication. Additionally, ongoing research is exploring the genetic and molecular mechanisms underlying the development of this anomaly, which may lead to new diagnostic and therapeutic strategies in the future.